Surgery, the Renaissance Medi Spa. We're going to do a HydraFacial today for Amanda, our PA. Amanda just flew in from Denver last night, and actually this is the best treatment for her to have after flying because of the dehydration that happens while you're flying. So anyway, the HydraFacial is a treatment that hydrates the skin. We're using 4 different solutions, and with that, we've already cleansed her. I did a little exfoliating polish because that's part of the treatment, but this is giving her a little boost for exfoliating. And next step we'll be doing actually the first step, which has glucosamine in, which also exfoliates. And exfoliation is definitely important in daily skin care. So our first step will be using a blue tip, and the blue tip actually exfoliates, and using a solution with glucosamine. We do quick strokes. Amanda shouldn't feel any pain or anything, and she'll just let me know. Are you good? Mm-hmm. All right. I'm just going to cover your eyes here. Putting on a little eye protection. And we dampen the skin with the tip first. And like I said, quick strokes. And because we haven't dermaplaned her first, which is also can be done before the treatment, I'm going to crosshatch and do double exfoliating. So after we've finished exfoliating, we're going to do a chemical exfoliation also. So there's a lot of exfoliating done in this treatment, but to actually allow that product to absorb and to hydrate better. So we're going to do a lactic, which is more universal chemical exfoliation for everyone, even with sensitive skin. The other option is a lower percent, 7.5% glycolic and 2% salicylic. But for Amanda, we're choosing the lactic.
Yeah.
So now we're applying the lactic, just doing quick strokes also, and leaving this on for a minute. Safe enough even to apply in the neck area. Might be a little spicy feeling for Amanda.
Feels good.
Feels okay? Mm-hmm. Yeah. After we applied that lactic and waited for about a minute, I'm gonna buff it. And this is only done with the lactic. And then we're gonna use a little water to rinse it off. Next step will be extractions, and this is using a green tip, and the green tip will actually soften the sebum to allow the blackheads or the whiteheads or whatever to actually come out easier. We still may have to do manual extractions as well. But with the extractions, we're gonna do a slower stroke and go over the T-zone area. And this is using a beta solution to actually, like I said, to soften the sebum. After the extractions, we use an LED blue light, and the blue light helps to inhibit if there's any bacteria. So we're going to do about 3 to 4 minutes of the blue light going into the T-zone areas. We have finished with the blue light. Our next step could be a vial. We have 3 different vials. We have a derma builder, which actually are peptides, proteins for fine lines and wrinkles. We have a human growth factor, which actually is the powerhouse for fine lines and wrinkles. We have a Bright Alive vial that is to brighten up the skin. So those are vials that can be added on at this time to the treatment if the client and I decide that that's, would be actually a good thing for their skin. Otherwise, we're gonna go right now to the step of the antioxidants. And antioxidants help with neutralize the free radicals that happen through the sun, through this environment. So these are hyaluronic acid, which is really a key ingredient in this treatment, and then the antioxidants go along with it. So our next step will be using a white tip, and with this it's a little drippier, but actually it'll feel really good after we've done all the exfoliating. So our final step for the treatment will be using a red LED light, and this actually helps with product absorption. So we just have applied those antioxidants, so we want all that good product to be absorbed into the skin, and then we'll also helps with inflammation. If there's any redness in the skin tone, it actually will help that settle out. Helps with anti-aging. The red light is a great tool in the treatment. So our final step for the HydraFacial will be just applying a product. So we only use another moisturizing product, which is Pure Moist from the HydraFacial company. So I'm just going to put a small amount of that on, and then Amanda will be ready for makeup or whatever she chooses, sunscreen, makeup, and she's ready to go. If you're interested in HydraFacial treatments, they're very beneficial for everyone. You can do these every month if you'd like, every 6 to 8 weeks, whatever works for your schedule. Recommendation is probably 4 to 6 weeks apart. And then your skin is well hydrated and ready for these winter months. Call our office if you're interested. Thank you.